Hey, it's Chris Bowling.
Chris Fire, what's up, CB?
Hey, I am loving this little series of I got my backpack. I'm heading into school. I got all my cool stuff. Can't wait
Ready
to.
to go.
And
So
this,
now we're talking about the CFO and finance team's backpack. What's in their backpack going into the fourth quarter to be successful at managing their health plan and benefits? I think the first one we say is don't rely just on the claims data you get from your carrier or your third party administrator. That's a story of what happened, providing tools to our clients that help them identify conditions on the plan, projected costs based on those conditions, and then ways that we can help improve the performance of the plan because we understand what's going on. Just relying on a TPA report that says we had claims is not an analytics tool. There's so many better ways to be prepared for your future and know your budget.
just the budget all, I'm shocked of how many CFOs, and again, I don't blame them. I blame the consultant, hasn't set a budget on a PM basis for both
Yep.
medical and pharmacy, and then showing national trend to determine
Yeah.
how well are you doing? Are you beating national trend or are you worse than national trend? If you're worse than national trend, obviously you need to make some changes. We're gonna
Yep.
you need to stuff some more stuff in your backpack to get this
Yes.
plan to perform better. But yes,
The
barrier.
best scenario is looking at that monthly. How did we compare? And if we put in a new tool or solution, did it bend the curve? And that tracking really helps validate the decision to invest money in a new program or to take something off that's not working.
Totally.
The other thing we're seeing too is the reinsurance market. I would encourage every CFO to put an evaluation of how they buy reinsurance in their backpack this year. We see great clients with good loss ratios on their stop loss every year, still getting an increase because of trend,
Yep.
and they're just handing money over to the reinsurance carrier. Of course, they'll win a couple of times,
Right.
but we've certainly found that there are ways that you can keep those dollars on your balance sheet, retain the profit of a good year, and also protect yourself against the bad year that does happen. And
Right.
it's not buying traditional stop loss and reinsurance. There is a much better way, and the best CFOs have that in their backpack because we brought it to them.
And it's such an easy analysis. I mean, it takes minutes, right?
Yeah.
Over the 5 years, what have you paid in premium? What have you got back in reimbursements? Who is winning?
Yes.
You
A
or
lot of
them?
times it's the carrier, and
Yep.
we can help the employer win and keep that money again on their balance sheet. We've touched on this many times, but the pharmacy program, there's a lot of employers that are still relying on a big PBM, or they might even have a transparent PBM, but it's not in sync with their goals of how they source drugs and make it better. What are we finding there that needs to be in the backpack?
I think you got to have a PBM that is every time a prior auth is coming through for a high cost drug, they're looking at multiple sources of how do we get that drug for the lowest cost and to the lowest cost to the employee. And again, what we just talked about on the HR backpack is waive their cost if you can get that
Yep.
drug sourced in a better way.
Yeah, and I would say the last one truly is just evaluating your TPA networks.
Right.
And I think we say that some large networks are good, some small networks are good, but it's not all about the discounts. It's truly about what are we paying for the procedure? Is it the right cost? And are there better methods in order to get that cost lower and still provide the employees with better care? And there truly are. Sometimes that's going to be disruptive, sometimes not. But if you're not evaluating that and you're just relying on what we see from a discount report, you don't have the right tool in your backpack.
I'll go one step further on the TPA is how are they paying claims? I mean, yes,
Yeah.
discounts are important, but if they're taking, a 2 weeks hospital stay and it's a bundled payment and they're just cutting a check, you're paying thousands of dollars more than you should. So
Yep.
discounts are good because for the majority of your claims, the discount's going to matter. But for the 5 to 10 claims that are going to be those big ones, gosh, I really hope you have a good TPA that's diving into that claim, making sure that it's the right amount. And, again, what kind of case management is there? So, we
Yeah.
can avoid
Making sure
that.
we keep those
Keep
people
people out
taken
of the
care of. Yeah.
hospital if you can. But
Absolutely.
yeah, TPA is important.
Absolutely. So CFOs and HR teams both. We like to have these conversations about what's in your backpack going into the school year, third quarter, fourth quarter, because there's ways to make an impact as you go into 2026.
Yeah.
Good talk, CB. Good to
You
see
too,
you.
man. We'll see you.